Hello, I'm Erin Cox. Today we're going to talk about the biomechanics of the distal radio-ulnar joint. We already looked a bit about the anatomy, so just to know that we have the radius, which usually goes into pronation or supination, which means it usually moves over the ulna. So a couple of things of note here. So the distal radio-ulnar joint, we said, is concave on convex. So the radius is concave over the convex ulna. So if we want to do pronation, then we're going to do a palmar glide with a roll toward pronation. And if we want to do supination, we're going to do a dorsal glide with a roll into supination. We talk about the proximal and the distal radio-ulnar joints forming a modified cellar together. So the interosseous membrane in the middle, but in the proximal part, because we have the round head of the radius, now we have a convex on concave situation. So as the two move together, we have this moving in the same direction and this moving in the opposite direction. We're going to look at the proximal radio-ulnar joint more with the elbow. Another thing of note, they sometimes talk about in the biomechanics that the ulna tends to abduct with pronation. So can you see here that we have a vertical axis going more or less through the ulna, but as we do pronation, as the radius comes over, there is some movement of the ulna going out laterally. And now you can see that its axis is more pointed out laterally or more in an abduction. So that's why they say the ulna goes into abduction. And then in supination, it moves back and moves more into an adduction. So if you see that in the notes, that's what they're talking about. I'll just share the screen for the rest of it here. So the biomechanics of the inferior radio-ulnar joint or the distal radio-ulnar joint. So the articular surfaces, so it's a synovial joint, it's a modified ovoid and part of a joint complex. Like we said, it's a modified cellar when acting functionally with the superior radio-ulnar joint. So the degrees of freedom are pronation and supination. So the closed pack position of the inferior radio-ulnar joint, full pronation and extension or full supination for closed pack position. The resting position is in mid position, so slight pronation, slight flexion, and slight ulnar deviation, which you'll see is sort of the theme for the hand. Capsular pattern, equal limitation of pronation and supination. And the normal end feel supination would be more capsular, and some say that pronation is a bit more bony, but it's capsular, and also sometimes you'll also get a muscular stretch, which would give it more that capsular feeling as well. The osteokinematics. So pronation and supination, it's an impure swing about a coronal axis in a transverse plane. So I was explaining how that axis goes in that vertical position, along the ulna and then the transverse plane. So I guess it's more of a vertical axis instead of a coronal. The ulna adducts with supination and abducts with pronation, as I just showed you. And when we do pronation and supination, 90% of the mobility should be at the radio-ulnar joints and then at the wrist. So can you see if someone cannot do their full pronation, that they might tend to try to over-pronate in the wrist area, and this could create a hypermobility in the wrist. So we always want to overpressure at the radio-ulnar joints, and we'll do that in proximal, middle, and distal, and then overpressure at the wrist, and see how much relative movement we get at each part of the complex. Arthrokinematics, so now we're talking about the glides and the joint surfaces. So in supination, it is a posterior glide with a posterior rock of the distal radius to produce that supination. It's going to be in the same direction. And also, if we're missing supination, look at the fanning of the hand. So in the hand section, we talked about fanning and folding. Supination goes along with fanning. And pronation, as I just said, is more of an anterior glide with that anterior a rock to get the end movement of the pronation, and it would go more with folding of the hand. Thank you.